Welcome to this episode of Doctor-Patient Conversations. Today we bring you a very common and often ignored topic of urinary tract infections. Dr. Sudeep Roy has kindly agreed to answer the questions that come to our mind. I, Nadira Chaturvedi, represent Patient's Voice, brought to you by Patients for Patient Safety Foundation. We will ask questions and Doctor will answer. Thank you, Doctor, and for joining us and helping us out. As an introduction, Dr. Sudeep Roy has been a doctor for more than 25 years, but his passion, I think, lay in microbiology and infection control. And he has devoted a major part of his life to curating and preventing infections among the common people. So that is why he's an apt person to tell us about the urinary tract infections. Welcome, Doctor.
Yeah, thank you. Thank you for inviting me in this podcast.
What exactly is a urinary tract infection or UTI, and where does it occur in our body? Is it always serious? Does it happen to everybody? Can you just explain what it is, first of all?
The first thing that I'll say is that urinary tract infection is the most common infection in the human body that we encounter on a daily basis in our OPD, in the hospital, IPD settings also, indoor patient settings also. So how it happens basically, if you look into the urinary tract, we have got exactly four major parts. One is the kidney, another one where the urine is getting formed. Then the urine is tracking down with the ureter, through the ureter and coming into somewhere where it is getting actually there for the urinary bladder. Okay. And it is coming out through our body, through the urethra. So these are the four parts. Anywhere it can have the infection, but the most common infection that we see on a daily basis is the infection of the urinary bladder, which we call basically a cystitis. So that is how it happens basically.
So as a person, all I feel is a burning urine, or occasionally it may be blood. I don't even realize that if I have pain, it is there. So what are the symptoms, the signs, the early signs that it could be a UTI and not just a passing dryness of water?
The symptoms basically vary as per the sexes also. Okay, it can be a different in case of males, in case of females, it can be different. In case of children, it can be different. In case of an elderly person, it can be different. But the most common symptoms that we see in case of females are basically there may be an abdominal discomfort. It can start off with an abdominal discomfort. Then it can land into a burning sensation while passing the urine. And along with that, there may be some abdominal pain that can come. And ultimately, if it is a severe sort of an infection, it can lead to some fever or something, and where it will become difficult for the person on a daily basis to handle the thing.
So are you saying that it can happen at any time? Because I remember when my baby was little and she got UTI and I was shocked. We were so clean and yet it happened and she was in diapers. It happens to people who are lying in bed. So who is really at risk? Is it because they have another illness, or is it because of our own habits?
There are several factors, okay, depending upon the thing. The first point is that females are more prone to have the urinary tract infection because of some shorter urethra. It's near the vagina as well as the rectal and anal canal, where basically we do have some bacteria over there, and it can go through that shorter urethra and it can infect them. In case of, say, children, okay, maybe a sort of a bad hygiene or something like that, okay, and sometimes they do handle that particular area so frequently, so it can happen to them. In case of an elderly people who are basically bedridden or something like that, suppose for example, if the person is in the diaper, okay, and has passed stool, and nobody has noticed this for a long period of time, they can also have that particular infection. But in the common practice, what we see, it is the females who actually have got this one. Besides this, there are few factors like, say, diabetic people. Diabetic people are more prone to have urinary tract infections. If somebody is particularly in case of a male children, those who are having some abnormal or deformity in the urinary tract, and that we frequently see in the clinical practice also, they can have at that point of time some infections over there.
Right, right. So is it also related to other diseases? I mean, maybe if I have a surgery or if I'm, a lung disease or a cancer disease, is there any other comorbidities that contribute to a UTI, or are they independent of that?
You see, I see any infection. Okay, any infection can happen to a person who is immunocompromised. Okay, so if I think of the immunocompromised patients, any person having say any sort of malignancy or any of the things, they are basically immunocompromised patients. And these patients are always prone to have the urinary tract infection if not taken care properly.
So how do I distinguish? I mean, many times we go out in the sun. I mean, we live in North India, and or all the sunny places, and you don't drink enough water, you don't have access to drinks or fluids, and then you have a burning sensation. How do you detect it? I mean, how do you know that this is I should go to the doctor? When should I really sound the alarm and not just drink water and let it pass away?
Okay, the first thing is that if you are having, say, dehydration and having a burning sensation with the urine, you can understand that whether you have dehydration or not, just looking at the urine color. It will be more yellowish. Now, you drink plenty of fluid, you get the urine white in color and the burning sensation goes away. So you can understand that it is probably due to the dehydration. But in spite of you're trying for the hydration and other things, if it is not going there, okay, then probably you have got the first symptom related to the urinary tract infection. And obviously, there are few factors like, say, if there is a sort of a reddish urine, okay, that means the red blood corpuscles are coming into the urine. That is normally not there. Okay. So this is another indication, okay, it may be a urinary tract infection. Another point is that if you're having fever, okay, so if you have fever, definitely you should go to the doctor because it can land into a different sort of a trouble in future days.
So you've given us a good test. I mean, if we just try it out by drinking water and the color comes back to the original, then we are not in danger. It is reversible. But if
Right.
it still remains dark or orangish color, then we need to sound the alarm and go to the doctor, right? So what are the
Exactly.
complications if I ignore this? I mean, in spite of that, if I just keep going on because I don't want to go to the doctor, or I
Okay.
think I can manage it at home. So what would be the complications then?
So there are two ways we basically define this thing. Okay. One is most of the urinary tract infection is what we call ascending infection. That means
Yeah.
it is coming from outside, particularly in case of a female. So the bacteria is coming from, say, vagina or from the anal canal. It is passing through the urethra and infecting the urinary bladder. Right. Now, once the urinary bladder is infected, the urine can go up and can infect the kidney also. And certain point of time, it can come from up to downside. Okay, like there may be some sort of say sepsis or some kind of thing is happening, and usually we term it as a pyelonephritis, infection of the kidney. Okay, the pyelonephritis is a more severe variety of urinary tract infection than the infection of the bladder. Okay, so these are some of the severe complications that can come, that if you land up with this sepsis, then it will be a very difficult thing. And considering today's antimicrobial resistance scenario, there are very few drugs left to basically to treat, and we do not have much of the choice for the antibiotics to give over there. Okay, so that is a difficult situation scenario already.
Doctor, you mentioned three complicated words. One, you mentioned antimicrobial. The other, you mentioned sepsis. And the third is pylo something. Can you explain these a
Pyelonephritis.
little better so that we understand as people, as
Okay.
patients, and
See that what I've said already. Like pyelonephritis is what we call the infection of the kidney. Okay. If the kidney is infected, we say it is a pyelonephritis in the medical jargon. Okay. Now, sepsis is something when an infection is getting into the blood. Okay. So blood is usually doesn't contain any sort of infection whenever we are normal on a daily basis. But if it gets into the blood, then we term this as a septicemia or sepsis. And that is a severe scenario where basically you need to take care of a lot of things for that particular patient. And another point I think I've said about
Antimicrobial.
antimicrobials. Okay, so whenever there is an infection, we usually take antibiotics, right? Antibiotics people do understand. So this are basically, there are a lot of group of antibiotics are there, and we commonly call these things as antimicrobials.
So if I had to paraphrase that in my simple language, that means the kidneys can get affected, which is a little serious. And then is that reversible? That's my next question. It goes
Yeah,
into the
it is
kidneys.
reversible. It is
But if it
reversible.
goes into the blood, and that means it reaches all the other organs, which is that reversible or is it even more dangerous?
Yeah, it is reversible, but with
Both
a
are
lot of
reversible.
difficulties, right?
Okay, all right. So if it is reversible, that means I need to have some intervention, a medication or surgery. So what are the treatment options I have when I become serious in the initial stages as well as in the later stages?
Okay, so most common thing that we try is that we need to understand that urinary tract infection is essentially a bacterial infection. Okay,
Right.
so we have got antibiotics that is acting against this bacteria, and we need to put it forward. Okay, now difficult part is that antibiotics you can take it orally, or you need to take it, say, through your veins or some of the things. Okay, now most of the in the sepsis scenario, it is like that. Most of the antibiotics we give is IV, that is the intravenous, and that goes through the veins over there. Now, if I have to give a patient an IV antibiotic, then I definitely need to get that patient admitted in the hospital. That
Right.
will increase your cost. Say, suppose a normal UTI, say it may be for 3 days, 4 days, or 5 days maximum. But in case of a sepsis with UTI, it can go for 10, 14 days. So your cost burden, your health burden, everything is basically increasing over there. So that is one of the most bad effect of this urinary tract infection.
And what about the kidney part? I mean, you mentioned that kidneys can get affected. So how do you treat that one then?
Okay, kidney can be treated with same sort of antibiotics. Okay, so that antibiotic I'm giving to say cure for the sepsis, as well as I can give it for the kidney infection also. Okay, so I need to target the kidney and choose those antibiotics which are going to be there in the kidney and can kill those bacteria. So over a period of time, the infection that has happened over there, it can come down.
So which means the treatment can be short term and it can get reversed if it's in the early stages,
Yeah,
but it will
yeah,
be longer
definitely.
term if it becomes more serious.
Yeah, and if people with say comorbidities means suppose a person is having say diabetes, suppose a person is having say malignancy, in any of the immunocompromised cells, the immune system is not working
Right.
over there. So in those cases, it can become literally difficult.
Doctor, what about patients? I mean, my sister has been bedridden for about 4 years, and I know she has to wear incontinence, and even elderly people, my in-laws used to wear, diapers and all that. Is there anything that you would like to tell us to prevent UTI in spite of having, including children? I mean, we travel, they wrap them up in bundles. So what are the precautions and the preventive practices to prevent the UTI, not just to cure it?
Okay, so first thing is the hydration. Okay, so you can understand that uh, if you suppress the urine urge, okay, suppose in what happens in case of female, they do not get a proper restroom or some of the things, and the entire day they are just putting it on hold. But we need to remember that if we put this entire urine on hold, so there can be increase in the bacterial load over there. So the bacteria can increase over there. It can come into and can have that particular infection. So you can drink plenty of water and you urinate whenever you have got that urge. And that is what is the thing. The next point that what you have said, suppose a bedridden patient, okay, incontinence is there. That means incontinence means suppose urine is leaking slowly, or there may be some anal incontinence where the stool is constantly being passed over there. So there you need to have a proper hygiene over there. Hygiene means you can have, there are wipes available in the market also. You need to wipe those area properly. Okay, and you need to keep that area clean. Now, what happens? Sometimes people do have a tendency to go for wrong technique of wiping the things. Like they go from back to forward, means from the anal canal to the urinary system, they do the wiping like this, but that is the wrong technique. Okay,
Right,
so what you
right,
have
right.
to need to do is from forward to back side. So that is another way you can do. And there are some of the supplements that can basically help, like say probiotics. If you keep the urine acidic, means if you can have a lot of citrus fruits, some vitamin C containing fruits, cranberries, that can also help over there.
That is an interesting one. I mean, the way you mentioned, even the cleaning technique has to be front to back so that you're removing the infection and not allowing it to come forward, which I don't
Right.
think most people know about this, even if it's water or even if it's with a wipe, even then, right? And
Right.
holding urine, because we often find the burning when we've gone traveling and we have had long, items like that. So do you
Right.
mean that diapers should never be used?
Yeah, you have to use diapers if a person is having incontinence. Okay. So diapers should be used, but the diapers should be checked very frequently, because if that person is not having the sensation that they are passing some of the things, okay, they may not raise that particular alarm. Okay. It's like handling a small baby. If it is an adult patient, you
Yes.
have to take care like a small baby over there.
Right, right. What are the other daily habits that you could, tip us on of protection against this UTI?
Okay, see, daily
The home
habits.
remedies. First the home remedies, then the chemical remedies.
Okay. See, the simple home remedy is drink plenty of water. You pass the urine. Okay. And once you pass the urine, then it is fine. So your bacterial load is always getting less over there. The second point, for example, sexually active females. Okay. So after each and every intercourse, you need to pass the urine, drink plenty of water, so that whatever be the load has got over there, so it should go. Okay. Another thing is that you can make the urine acidic, more and more acidic. Okay. Like say, if you can take vitamin C supplements. Okay, that way you can basically put it, you can make the urine acidic. Sometimes people do take cranberries, okay, cranberry juice. But problem with the cranberry is that you need to take sugar-free cranberries, okay, particularly for the diabetic people, because cranberry contains a lot of sugar and it can increase the diabetic status of a person.
That's
Okay.
a complicated one here.
Yeah. Another thing that is coming up right now is using probiotics. Particularly, either you can take it orally or you can put it into the vagina. Okay, both the forms are basically available, and they can use this probiotics. So probiotics are basically containing good bacteria. Okay, so that will prevent the bad bacteria to grow, and that can help in some of the ways. But one major mistakes people are doing over there, that probiotics should be kept in the fridge. You cannot keep it in
Right.
the room temperature. Okay.
Okay.
Otherwise, those good bacteria are going to get killed.
So is that for curing or is that for preventing? The last exercise that you mentioned about the probiotics, yeah,
These are mostly for the preventing,
for
mostly
the
for the
preventing.
preventing. If
So, and right.
somebody is having, say, very frequent UTI, okay, we see a lot of cases like, particularly with the elderly women, okay, postmenopausal women, they are going to have some of this sort of things like maybe 2 or 3 episodes of UTI in a year, okay. So then we basically put them on this sort of medications and other things, so that the number of events should get less, actually.
Right. And you mentioned about intimacy and how you have to, particularly for the female partner to clean up, which means, is this contagious? Is UTI contagious? And is it more because of the, sexually active women, or because somewhere we read even in menopausal women, it happens more often. So what about that part?
See, the contagious is like that. It is not coming exactly from the partner. Okay. So what is happening? See, if your vaginal flora, vaginal bacteria is coming into the urinary tract, then it is going to cause some infection over there. Okay. So we need to prevent that thing. So what thing is that you need to constantly wash it out, constantly wash it out.
So the
And
hygiene is important. Yeah.
hygiene is very
It's
important.
particularly in sexually active women. Okay,
Exactly.
that's another one. Now, what about when you have a catheter? I mean, when you say anything invasive, that means can also carry infections by the same token.
Definitely. See, whenever you are going to put a foreign body over there, okay, the first thing what happens, like, say, when I'm introducing the catheter, okay, I can again see, I said about ascending infection.
Yes,
That means if you are putting catheter, you are going from the lower to upper side. Okay, so that way, basically, what can happen, like this can, we can basically introduce some infection. So it has to be something what is called aseptic technique. Okay, so you need to maintain the sterility while putting the catheter. That is the first thing. The second thing is that you have put the catheter is in place. Now you have to maintain that particular catheter. Okay. Now, if you are going to maintain that particular catheter, means what? That bacteria are more prone to form something what is called a biofilm. So on the catheter. So what will happen? It will stay on that particular catheter. Maybe it is not going to do something, but on one opportunity, it can cause some of the infection. Suppose if you have kept the catheter for a long period of time, okay, without changing or some doing anything. So that can also cause that particular infection.
right.
So these are some of the things. There are some catheter variations that are available where if you require a long-term catheterization, you can use those silicone catheters. That is a bit better than the normal catheters actually. Okay. There are quite a lot of other variations, but probably that is for the doctors, not for
Right.
the common person to understand actually.
So, but the catheter brings me to another thought. When we are admitted into hospitals as inpatients, and people talk about hospital-acquired infection, or you suddenly develop something, is it because of the bed sheets, or the nurses, or the doctors, or just us that we didn't sign? Is there anything more frequent in an HAI that leads to a, related to a UTI?
Okay.
And how can we prevent ourselves or be vigilant about it?
Okay. See, the first thing is that hospital-acquired infection uh, means you are doing something on that particular patient, and basically you are introducing this infection. The first point is that obviously a catheter insertion is one of the most risky part over there, but it can be prevented. The best thing what we have learned from the COVID era is the hand hygiene. Okay, your hand, if it is dirty, okay, you are definitely going to introduce something in the patient's body. Okay, so that is one of the thing that basically we basically stress on that thing, that whenever I am going to the patient, seeing a patient, I need to do some of the hand hygiene. Even the patient visitors also should do the same thing, because it's not only the part of the hospital staffs, but it is also part of the visitors also.
That's interesting. You explained a lot, and you've also given us hope, doctor.
Huh.
But may I request you for three takeaways that you would advise patients? You mentioned that it is both people. I fully agree. The healthcare providers as well as patients and families should be careful. So we need advice from you for the patient community, for people like us.
Okay. See, the first thing is that whenever there is an infection, the best way to handle that thing is to prevention. Okay. Not the treatment. If
Right.
it happens, we can go for the treatment. There are ways. Okay. But before it happens, we need to prevent the thing. So to prevent the thing, just maintain some of the simple things. You maintain your hydration. Okay. Whenever you have got the urge, don't hold it over there. Try to find out a place, go for that thing. Okay. So these are some of the things for the, say, food part. Okay, you can take, there are a lot of probiotics containing things. Okay, and that can have some of the beneficial effect on your body as a whole. Okay, and that can also prevent some of this infections. Have some of the nutritious foods. Try to keep your urine acidic in that way, like say citrus fruits. These are some of the things that can help actually. There are few known facts related to, like what I have said about the cranberries. Okay. So these are some of the things that you can try, okay, to for the prevention. Hygiene is one of the main thing that I have mentioned, that front to back wiping is the technique that you have to do. If you have to use, there are some of the disinfected wipes are available. And since a lot of females are getting into the work and they do not have a restroom, and they already the restroom is, say, I'll say it's a contaminated place, okay, because a
Yes.
lot of other people are using. So use those wipes to wipe the seats over there. Okay. So that way also you can prevent, at least if you can prevent at least one event, your life is going to be much better.
Thank you, Doctor, for saying it so beautifully and summing up so many things that we have in our hand, in our control to do it. So the doctor has wonderfully summarized, and I think by following these just simple 3 practices, one is hydration and relieving yourself at any chance and not holding back the urine. Don't think that you're strong because you just held back for hours and hours, particularly while traveling or even at work. The second, he's talking about hygiene and the way hygiene is practiced by ourselves in our cleaning, and anything that can come in from outside, we need to be aware of it. And the third, I think it is important to know how can children be kept clean, how elderly people, bedridden, can be kept clean, and women. I mean, that was a wonderful insight that even younger women can get it because of poor practices post sexual intimacy, etc. So I think keeping these in mind going forward, let's hope on this Women's Day occasion, more and more people follow it and less people fall ill to it. Thank you, Doctor. Please join us for every conversation with the doctors. And thank you once again for being with us.
Thank you. Thank you.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material, which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.